The scientists say these results suggest that testosterone therapy has the potential to reverse the resistance that eventually develops to testosterone-blocking drugs like enzalutamide. 3 of the study participants have died since the survey began in 2010. The rest are still alive. During the cycles of etoposide, many of the men experienced the usual side effects of chemotherapy, including nausea, fatigue, hair loss, swelling, and low blood counts. In men receiving only the testosterone injection, however, side effects were rare among the men and usually low grade. Over time, however, the advantages of testosterone injections decreased. PSA levels began to rise after about 7 months, suggesting renewed growth by the tumors. But even a short-term response could extend the lives of patients because prostate cancer that is resistant to chemical castration is usually incurable, Schweitzer notes. Although a few previous studies attempted to measure the effects on prostate cancer of boosting testosterone levels, they didn't provide the large doses of hormone necessary to kill resistant cancer cells, he says. So the new work, quote, is a first step toward finding out who will benefit from this treatment. Quote, this is the most lethal form of prostate cancer, end quote, said Dr. Schweitzer. Quote, it's the one that's the most resistant, and once people progress to this stage, it's when we start to worry that they're at a much higher risk of dying from prostate cancer, end quote. Some researchers and doctors were concerned that testosterone treatment might accelerate tumor growth, notes Charles Ryan, a cancer endocrinology researcher and physician at the University of California, San Francisco, who wasn't involved in the work. But the study shows that, quote, there's potentially a substantial number of patients for whom this treatment is not harmful, but is possibly beneficial, end quote. However, he's not going to change how he treats prostate cancer patients until researchers perform further studies that confirm the effects of testosterone and clarify the treatment's risks. Quote, they have intriguing clinical data, end quote, says medical oncologist and prostate cancer researcher Christopher Logothetis of the University of Texas Cancer CENT-MD Anderson Cancer Center in Houston, who also wasn't connected to the study. But he was disappointed that the team didn't test biopsy samples from the subjects to determine how testosterone was affecting the tumors. That analysis is essential so that researchers can figure out how to predict which patients will benefit from the treatment and which might be harmed, he says. Quote, this was a small study and it was a weird idea to give men with prostate cancer testosterone, end quote, said Dr. Denmead. Quote, the results were unexpectedly promising and we'll need a lot more study, but this cycling on and off of testosterone could become a part of the treatment, end quote. This research is a deadly serious study and it can have grave consequences. One patient died during the trial from pneumonia linked to the chemotherapy that was part of the treatment approach. A prolonged erection, a possible side effect of testosterone therapy, led another patient to drop out of the trial. Denmead warns that the timing of testosterone treatment used in his research is critical and difficult to determine, and says men should not try to self-medicate their cancers with testosterone supplements, available over the counter. Previous studies, he adds, have shown that taking testosterone at the wrong time, and particularly by men with symptoms of active cancer progression who have not yet received testosterone blocking therapy, can make the disease worse. The researchers exploited a vulnerability created as cancer cells adjust and become exquisitely sensitive in a low testosterone environment. Previous lab work showed high testosterone could kill prostate cancer cells, though there wasn't compelling explanation for how the process worked, Schweitzer said. It may be that cancer cells that have adapted to the low hormone environment can't tolerate high levels of testosterone, according to an editorial summary that accompanied the paper. In men whose prostate cancer spreads, doctors typically prescribe drugs that block testosterone production, but cancer cells eventually become resistant to this means of reducing the hormone, says Denmead. At that point, physicians switched to other drugs, such as enzalutamide, which block testosterone's ability to bind to receptors on prostate cancer cells. Denmead says the combination of medicines that block testosterone production and receptors, called androgen deprivation therapy, may make testosterone cancer more aggressive over time by enabling prostate cancer cells to subvert attempts to block testosterone receptors. And, as mentioned earlier, many men on these drugs experience horrible side effects. With this context, the new study tested an approach based on the idea that if prostate cancer cells were flooded with testosterone, the cells might be killed by the hormone shock. The cells also might react by making fewer receptors, which may make the prostate tumor cells vulnerable once more to androgen deprivation therapy. Denmead says that more studies are being planned at Johns Hopkins and other hospitals. The Johns Hopkins researchers have another study underway that will involve 60 patients, and a larger nationwide study is slated to begin this spring, Denmead said. Quote, "There has been a groundswell of interest in the idea of reversing resistance to androgen deprivation therapy. We have plenty of anecdotes and some evidence in this small study, but it's important to test it in larger groups of patients," end quote, he adds. 2 other studies of testosterone therapy in patients with castration-resistant prostate cancer have begun, Schweitzer notes. So researchers may soon have a better idea of whether the treatment is superior to current approaches. Thus, the research continues and offers hope for the millions of men that are currently suffering from this deadly affliction, and the countless numbers of men who will develop the disease in the future. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.